Hi, we're going to go through how to change a mallet finger splint today. So you'll have already been provided with the splint probably from Hand Clinic, this thermoplastic splint. And just a little brief review. Mallet finger is when the terminal tendon has come off, and so we need to support it for a total of 6 weeks continuously. If you take it off and bend your finger once, we'll have to start over the clock at day 0 and go for another 6 weeks. Okay, so because of the COVID issue, we're trying to show people videos or do things via Zoom. So you have your splint here and you'll have all your supplies ready. So a pair of scissors to cut off the old taping from last week or whenever you changed it last. And I like to have some alcohol or a wet washcloth to clean the finger. And then your tape, whatever tape you're using, hockey tape or athletic tape that you've purchased from the drugstore to reapply the splint. Okay, so first, and also you'll need a towel, and I like to prop up the towel like this with like a little pillow so that we can prop up the end of the finger, that last joint. Okay, so cutting it off, always use one hand. So if you're right-handed, use your left hand to support the tip of the finger where the tendon has come off the bone. So you'll hold that and keep that supporting that at all times. The patient has their elbow on the table, and that just keeps their hand steady as opposed to, not being still. It's supported on the table, okay? So we will just cut along. I typically just cut along the side of the splint where the splint meets the finger. And you can cut both sides. A little bit easier if you have some little scissors, that helps, but anything will do. So keep supporting it. See, I'm still supporting the tip of the finger as I peel the tape off. The person's elbow is still on the table, and then I just pull the tape but keep supporting the bottom. Okay, and then I can take the splint off, and then I just hold their elbow, slide it back, and rest the tip of their finger on that little pillow that you created so that the tip is still elevated. The patient's only job is just to relax, okay? And we like to give it a bit of air time because the poor finger is in the splint all the time, and if they get it wet or if it sweats underneath there, the skin can macerate, and we don't want the skin to macerate and create an open wound. So maceration is kind of like when you wear a Band-Aid and go into the shower and then you take the Band-Aid off a couple hours later and the skin is all wet. We don't want wet skin underneath the splint. Okay, so as we let it air here, I like to take a wet cloth or a alcohol pad or hand sanitizer, that's in short supply right now, and just clean the finger so that it gets cleaned a bit. And if you like, you can support the tip and clean the bottom. Okay, or we can use hand sanitizer and just let that evaporate. Okay, alcohol-based products is good because it will evaporate faster, and also you can clean the splint with the alcohol. You can wash it as well, but just make sure you dry it thoroughly so there's no water stuck in between these little holes here. Okay, and so I like to let it air for 5 minutes, if you like a little bit longer, as long as the patient isn't going to move out of the way and remove their finger. And then I will prepare I usually use 4 or 5 strips here of tape, about 2.5 inches long, and just have them taped to the edge of the table. So again, you'll use hockey tape or fabric tape. Okay, and after 5 minutes, tick tock, then we will hold up the finger again. Okay, and if you like, you can put a little piece of tape underneath here just for cushioning or just for protection of the skin so the splint doesn't stick, isn't pressing right onto the skin. But you'll place the splint on, okay, and the splint just is flush with the tip of the finger. And then support the tip of the finger, pinch it again with your non-dominant hand. So if you're right-handed, use your left hand, and slide the patient's elbow on the table, and you'll still be supporting this. You'll take 2 long pieces, okay, and this long piece pulls the finger up into the splint to give it that little bit of hyperextension, or at least to help hold it straight up into the splint. Okay, and we leave the middle joint free. You don't want to tape that middle PIP joint, so this joint is free. Okay, another piece to pull them straight up into the splint. You can give it a little pull, and then I like to press it in place so there's contact with the splint and with the skin or the finger, okay? So you can press it into place while still supporting it. And then I take a piece just on the bottom, and I like to go just enough to go over the edge of the splint and have contact with the skin, but not block the bending of this joint. And then one piece on top, circumferentially a few times. And then a nice hug. You don't have to be gentle. You can do a nice hug to make sure that there is enough contact. Now sometimes, if there's too much, you can cut the excess off. Sometimes if there's not enough, this edge of the splint will kind of hinge up, and you can see a little hole in there. So you can take a thin piece and just make contact with the edge of the splint onto the finger, okay? And another squeeze hug, and then it's important that the person use their finger normally, so don't hold your finger straight like so, okay? You need to bend this joint with the other fingers as opposed to holding it straight to keep it out of the way. Otherwise, another deformity called a swan neck deformity can develop. And there you have it. And so you can change it, you know, once or twice a week, or if it accidentally gets wet, it's important to change it so the finger doesn't get macerated underneath. Thank you.